All right. So welcome everyone to today's webinar, Quality Improvements in Community Mental Health and Addiction, not just another buzzword. We have one short hour together and we're cognizant that it is 12 to 1 o'clock, so you're hopefully all enjoying your yummy lunches, and so we'll try to make this interesting. And so let's get started.
Thank you, Julie. So just to start things off, a couple of quick housekeeping items. We are using the GoToWebinar software. For those of you that aren't familiar with this software, hopefully you've all been able to connect with your telephones. If not, the details are in the box on the top right-hand corner of the screen. So if you're unable to hear, just let us know in the chat box, because that is also available to you, hopefully. If somebody wants to just pop in hi, hello in there and let us know that it's working, that would be great. Also available to you in the GoToWebinar panel on the right side there should be some handouts. We've made the slide content available in both English and French, and there's also a couple of other handy attachments there for you to peruse. We'll be making the handouts available after the webinar as well, and we are recording this so it can be posted on our web pages and you can view it again at your leisure. So another kind of new thing for us, we're trying to make the conversation a little bit more interactive for you folks sitting in your offices. We are using the Poll Everywhere software today, so we're going to do things just maybe a little bit differently and have you grab your mobile devices and open up the web browser. You can also do this in a tab in your web browser as well. And you're going to go to pollev.com, type in maxb059 when it asks for the presentation, and let's just follow the prompts from there. So every time we have a poll, it'll also remind you of these details at the top. So if you join a little bit later on or you close your browser by accident, and we can go from there. So it looks like the chat isn't working. So if you have any questions, please pop them into the question box. We'll have some time at the end to hopefully answer your questions. But again, we're going to make things a little bit more interactive today. So please follow along with Poll Everywhere. And it looks like some people have already started joining us. So
we've got some keeners on the line today, Alex.
Hey, it's working. This is fantastic. So we've got hi, hello. Great, some smiley faces. I think emojis and emoticons also work if you want to try those, folks. So far, no francophones, it looks like. We got hey, hi, children. Oh, wow. People are getting creative. Loving this. Great. Happy Thursday. Yes, happy Thursday to you as well. It does take the first 25 responses for those that are coming in a little bit later. Sorry. It's not that we don't want to hear from you. It's just to keep things from getting a little too busy.
It's the spirit of competition, right?
Right. So you gotta be quick. So now that we've said hello to everyone, just a quick introduction of ourselves. My name's Alex Clement. I'm a quality improvement coach with the Excellence Through Quality Improvement Project. And today I'm joining you all from Sudbury, which is experiencing a weird summer fall day. So hello, everyone.
And I am Julie Brault calling in from Ottawa. I'm a quality improvement specialist at the Ontario Centre of Excellence for Child and Youth Mental Health. C'est aussi mon opportunité pour dire allô à mes collègues francophones et vous dire que vous pouvez suivre avec le PDF qui est dans la section Handouts avec les diapos en français. S'il vous plaît, sentez-vous libre de participer à tout moment en français. Ça me ferait plaisir de vous répondre. And so let's see if I can control this too. Let's just have you keep clicking, Alex. I'm not sure the delay.
No problem.
There we go. So the objective of today's webinar is to provide the context for investing resources and energy on quality during such a period of transformation. to give everyone an overview of quality improvements in the community mental health and addiction sector, and to introduce you to our respective QI programs, E-QIP and Quest. But now, pick up your phones because we'd like to get to know you a little bit better. So, where are you joining us from today? D'où est-ce que vous nous joignez aujourd'hui? Apologies if you don't appear on the map. But let's see. Oh, I'm seeing some flags popping up.
Nice. And for those that need a reminder, the details for the interactive poll do flash up at the top of the screen. It is pollev.com/maxb059 for the presenter name. So it looks like we've got a pretty good cross section.
Yeah, we've got it covered.
Hello to my folks in the north. Always happy to see some people joining us from there. And next poll on the screen. So we've got public health, nice. Broadening our scope a little bit. Primary care, welcome. CYMH representing. Addictions, mental health and addictions, great. Eating disorders, exclamation mark. Well, welcome, happy to have you. Supportive housing. Community services, great.
Great, so we've got many sectors.
Fantastic. All right, well, those are rolling in. We'll jump to the next question. So what's the first word that comes to mind when someone says quality improvement? And Julie, if you want to add our French version.
Quel est le premier mot qui vous vient en tête lorsqu'on vous dit amélioration de la qualité? Innovation, PDSAs. Okay, great. Boring. Oh, well, we're going to change that today.
My thoughts exactly. Love those.
I appreciate the honesty.
Well, hopefully we will touch on. Oh, we've got, yeah, great. Continuous outcomes. KPIs. Perfect. And great. So now that we've heard a little bit from you folks today and we're getting an idea of who's joining us, hopefully we can kind of speak to a little bit of everything that was brought up in the last slide. But first we wanted to take a couple of minutes just to sort of set the stage and talk about quality, obviously the name of the game for this webinar today, but what that means for our current sort of landscape in the health and mental health and addiction sectors. So as you probably already have heard, we are undergoing a pretty substantial transformation in the healthcare and mental health care system, part of which being the creation of Ontario Health, which has been kind of dubbed a super agency that sort of amalgamates the functions of the LHINs, as well as 6 other provincial organizations, including Cancer Care Ontario, Health Quality Ontario, and a few others. The full list is available there on the slide, and we've also tried to link folks to other resources as they are made available. So when you have these slides, you can do some extra reading if you'd like to do that as well. So one of the ideas of Ontario Health is to sort of integrate the key responsibilities that were held previously by those other 20 organizations. It's going to provide a lot of system oversight, also look at population-based programs and clinical and quality standards, as well as really provide some system management and oversight. Really, of course, keeping with the theme of today's webinar, we wanted to emphasize that improving the quality of care was identified as one of those key responsibilities under system management and performance. And one of the ways that Ontario Health is hoping to accomplish this goal of improving the quality of care is by developing something called Ontario Health Teams. These being groups of providers and organizations that are going to be held accountable for delivering a full continuum of care to a defined geographic population. So these Ontario health teams are going to be responsible for making sure that multiple components are met as part of the model. These folks would have put in an expression of interest earlier in the spring, and as of July, it was announced that 31 groups of providers have been invited to proceed to the full application process to becoming an Ontario health team. And again, they'll be asked to speak to these 8 points in the model that makes up the Ontario health teams. Number 8, of course, being performance management, quality improvement, and continuous learning. So you can see that this is being emphasized kind of throughout the whole system. So at maturity or full implementation for these Ontario health teams, they are kind of obligated to meet the set of criteria that's been listed on the slide here. I'm not going to go into all of these in full detail, but the one we really wanted to emphasize was that these Ontario health teams will be asked to report and monitor progress and performance towards a standardized framework that's aligned with the quadruple aim. And if the quadruple aim is sort of a new concept for you, we wanted to sort of demonstrate what that is here on the slide. And the quadruple aim is really an approach to optimizing health system performance. So a successful healthcare or mental health care system should be working relentlessly to achieve all 4 of the aims listed here, including better patient and caregiver experience. And of course, depending on what the work you do, you may use the term client or participant, member, resident, you name it. They would be included in this one right here. They also suggest that one of the aims is better population health outcomes overall, as well as better value and efficiency and better provider experience. Provider being those frontline staff, clinicians, administrative folks, volunteers, everyone that's really involved in making sure that clients are able to receive and access the care that they need. So the ministry has gone ahead and kind of indicated what some of the desired outcomes would be once these aims have been met. I won't go through all of them here, but for example, when we're talking about achieving the aim of better patient and caregiver experience, one of the desired outcomes would of course be people receiving access to the care they need when and where they need it. And of course, if any one of these aims is not being pursued, it's really suggesting that a critical piece of the healthcare puzzle is missing. So the 4 aims work in conjunction with one another.
Thank you, Alex. That was a really helpful overview. So now I'd like to take a few minutes to speak to quality and quality improvement specifically, and what that work may look like in your organization. So next slide.
Sorry, there we go.
No, that's okay. All right, so what is quality improvement and why do we do it? Well, quality improvement is a systematic approach to making change. It's about systematically approaching how we identify problems, how we dig into our root causes, how we engage with our stakeholders, and we explore and we monitor possible solutions. It gives us a framework, which I like to call a toolbox, as well as a set of tools that ensures that our improvement efforts are just that, improvements, and that we're not just making changes over and over again that don't make up an improvement. So a systematic approach like this to improvement in mental health and addictions leads to better client outcomes, as well as a higher performing healthcare system, which is why we all work so hard at the work that we do in this sector. So in other words, in terms of problem solving, QI is the exact opposite of throwing spaghetti up against the wall and seeing what sticks. It's about being systematic, taking our time, and taking things one step at a time. So in the next slide, you will see that there are all sorts of QI frameworks and toolboxes at your disposal. They all have some slight nuances and their own flavors, but generally rely on many of the same tools and techniques. And so if you could pick up your phones and let us know which QI frameworks you are perhaps the most familiar with or that you may be familiar with.
And again, that's pollev.com. And the presentation is Max B as in Bumblebee 059. So a lot of lean popping up. None. I appreciate your honesty. TQM, lean Six Sigma. These are your people, Julie.
the child and youth mental health sector is represented, yes. Co-design, experience-based co-design, I'm assuming. That's great. Six Sigma.
All right. So an overwhelming lean. And model for improvement.
There's your model for improvement. That's great.
Great. Thanks, everyone.
Okay, so I don't want to spend a lot of time on this slide, but this is my opportunity to acknowledge for folks that yes, it is not just you, but there are tons of terms and concepts and practices happening in the quality landscape. The purpose for today's presentation is not to distinguish between all of the concepts and things that you see on the screen, except for one small exception that Alex will speak to on the next slide. But just for now, take my word for it that they're all very important and play a crucial role in providing high quality services in our sector. So Alex, over to you for a quick distinction between QA and QI.
Thanks, Julie. So as shown on that Venn diagram, which I absolutely love, quality assurance and quality improvement are related, but still two very distinct different concepts. Quality assurance usually being the one that people are more familiar with in our sector because it often sort of arises in the way of checklists, audits, accreditation standards, and the like when we're looking at measuring compliance with a certain set of standards. Quality improvement is actually more of an iterative process where teams or service providers may identify an opportunity or a problem that exists that can be addressed and then lead to an improvement in care or processes or programs that really help clients. So this slide in particular sort of highlights a few of the different distinctions between quality assurance and quality improvement. Again, the one that I kind of want to focus the most on for this particular slide is the means, where again, when we look at quality assurance, it's kind of comparing, if we have standard X, Y, Z, where are we as staff or an organization falling in comparison? So are we meeting it, exceeding it, etc. Whereas quality improvement is more kind of a proactive or preventative method of doing things, where we see, again, sort of where there may be an existing problem or could potentially be a problem or opportunity to address that's going to help us exceed those standards through kind of working through a framework to help address that. And kind of a great segue into our next poll. So in your opinion, why is it important to focus on quality, whether it be quality assurance or quality improvement?
Alors, selon vous, pourquoi devons-nous mettre l'accent sur la qualité?
Yes, clients. I love it. That's what comes to people's mind, first of all.
Oh, ethical care. Oh, I love that. First, improved care.
Clients and the population. Definitely. Thank you.
Value for money, absolutely.
Couple of the aims from the quadruple aim there, value for money and improved outcomes.
Accountability, love that. To know that what we're doing is meaningful, absolutely. Yeah, why do we work so hard? Be proactive and not reactive, client-centered care.
Or people. I think that's probably the best way to really summarize it. All right. Thank you, folks.
That's great. So you've mentioned some of these, a lot of these in fact, but I just wanted to list some of the benefits of quality and why we invest our precious time and resources doing this kind of work. So let's kind of build the business case for it. So it aligns organizational practices with public expectations, creates motivation for continuous improvement, enables organizations to promote and sustain values regarding the provisions of excellence in service delivery, improve job satisfaction for staff, measures accountability. So quite a few people mentioned accountability in the previous poll. Promotes better outcomes for service users, exactly. So we're doing this for the clients first and foremost, and provides a structured link to risk management. Okay, so who is responsible for working on quality within your organization? Trick question, we all are. So a few stakeholders listed here, not trying to be exhaustive, but just want to mention some of the work that may be happening in your organization. So from board of directors that have the overall responsibility to setting quality and quality improvement as a priority, from then senior management making sure that it is a strategic priority and recognizing when that great work is happening. Middle management can help to create the environment where opportunities for improvement are welcomed and encouraged. Staff can be reviewing data and then working on some of the quality improvement projects. Families and your clients are raising concerns and can also be participating in the quality improvement initiatives themselves. Quality personnel can act as facilitators and can help roll out some bigger initiatives. And then your quality committee or quality teams can make sure that there are processes and policies in place to make sure that this work is happening. So here are a few scenarios that we wanted to bring to you that may seem familiar, that would absolutely be appropriate for a QI project. So I will read them out. So we've heard from our clients that it takes too long for services. I want to improve my access, intake, discharge, transition process. We aren't reaching several important client groups with our services, so I want to improve our reach to a wider spectrum or harder to reach population. We want to ensure that we are reaching those clients with the most complex mental health needs. We would like to improve the identification and assessment of clients entering into those services. So those are some examples of things that would lend themselves really well to a QI project. So now that I've inspired you with some of these project ideas, we are going to segue into how E-QIP and the center can help you on your QI journeys. So back to you, Alex.
Thank you very much, Julie. So as mentioned during the introductions, I am a quality improvement coach with the Excellence Through Quality Improvement Project, otherwise affectionately known as E-QIP. For those who are not familiar with E-QIP, it is a partnership between 4 provincial organizations, including Addictions Mental Health Ontario, the Canadian Mental Health Association Ontario branch, Health Quality Ontario, soon to be part of Ontario Health, as well as the Provincial System Support Program, otherwise known as PSSP at CAMH. And really, E-QIP was born out of a demonstrated need within the community mental health and addiction sector around QI or quality improvement capacity. So many organizations were feeling that they didn't necessarily have the language or the tools or the frameworks to start doing quality improvement in sort of a formal, directed way. So E-QIP was born, and really the goal of E-QIP is to help build and promote capacity around quality improvement within our sector, and also to sort of support and promote the use of evidence-based assessment tools to help facilitate that quality improvement work in order to improve mental health and addiction care in our communities. And the way that we do this as E-QIP is kind of working through 3 frameworks in particular that are sort of the how, the what, and the why, as I like to think of them. So on the left side of the screen, we have the model for improvement, which is the framework that we utilize most commonly as the Excellence Through Quality Improvement Project when working with our teams and organizations that are doing QI projects. This is, of course, one of many different frameworks. It's the one that we choose to apply to our work. So it is essentially 3 questions in a cycle. And while we're working with our teams, we look at what it is we're trying to accomplish, how we will know that a change is an improvement, and what changes can we make that will result in an improvement, and then running our hypotheses and testing changes through the Plan, Do, Study, Act, or PDSA cycle. So that being sort of the how, the idea is what are we trying to accomplish with this? And it's ultimately trying to improve care in terms of the domains of quality. So you'll see the 6 domains of quality in the center of the screen being safe, effective, equitable, efficient, timely, and client-centered. So when we're working through our quality improvement projects, making sure that those improvements are making themselves known in one of these domains of quality. And of course, ultimately improving care for the clients that we serve. And again, sort of this all lends to our why, which is the pursuit of that quadruple aim, and always trying to ensure that we're improving patient outcomes, improving provider experience, lowering that cost of care, making sure that resources are used effectively, and also trying to improve overall population health. And just to kind of elaborate a little bit on how we use the model for improvement to achieve this, we've got the model for improvement on the right side of the screen this time, and it's sort of superimposed with the QI stages and tools that we as E-QIP use. And when we work with our projects, we kind of guide teams through everything from the initial stages of creating a project charter and determining what the problem or opportunity that they're working on really is, doing root cause analysis to understand that problem better, using data and measurement to kind of determine frequency and how they'll know whether improvements are happening, as well as kind of developing and planning solutions in terms of having those change ideas and then testing them through PDSAs and ultimately trying to sustain those changes, because the work that we do to make improvements, we don't want kind of falling to the wayside or getting filed away in a binder somewhere where nobody ever sees it again. And the last sort of set of tools that I wanted to talk about are on the left side of the screen, which are part of experience-based co-design. And that's really about capturing, understanding, and improving the experience for clients, ensuring that the voice of clients and caregivers and family members is heard while we're working on these quality improvement projects, because it's really so crucial that we get their input and their participation in every step of the way, because they're the ones that we're ultimately trying to improve the care for, and who knows their experience better than they do. So all of this to sort of say that E-QIP does offer project-based coaching. We do it in a cohort model. We've had 3 cohorts to date. And when teams and project organizations apply to receive coaching from E-QIP, they kind of identify the problem or opportunity they'd like to work on, and then they're paired with a quality improvement coach as well as a data coach to help them work through the model for improvement, learn about the tools and methods and the framework themselves, apply it to their specific project, and sort of work through the steps that way. We also kind of help in terms of understanding and utilizing data to help facilitate that improvement project. There's provision of training and education sessions, of course, to help build that capacity internally. So really, at the end of the day, myself as a quality improvement coach, I'm really trying to work myself out of a job, because I really want organizations to be left with their own internal capacity and tools and language to continue quality improvement projects long after the project cohort ends and other things start to happen. A few of the priority areas that E-QIP has worked with organizations across the province with have kind of sought to help organizations align their services to Health Quality Ontario's quality standards. There's quite a few of them. You can find them all on Health Quality Ontario's website. They're really interesting documents to read, so I encourage people to go check those out. We also have helped organizations that are looking to better understand and improve client experience, improve timely access to services, as well as ultimately improve those client outcomes. So to date, we've actually supported 99 projects across the province. We are everywhere, north, south, east, west. If you can think of a place in Ontario, we've probably had projects there, so we're happy to help people across the province. The kind of honeycomb picture here demonstrates how these projects have aligned with the domains of quality. So we've had several looking at, ensuring that they're improving the client-centeredness of their programs, as well as safety, timeliness, integration, and effectiveness. And one of the projects that I sort of wanted to highlight to demonstrate how the coaching works is our friends at CMHA Durham. They were in one of our more recent cohorts, and when they applied for project coaching, they had identified that they had noticed over the past year and a half that there was an increase in the number of aggressive and violent behaviors that were resulting in a call to 911. So although it wasn't a huge frequency, these are pretty significant events. So of course they were working to decrease the number and the frequency of these events happening as much as possible. So we worked with the folks at CMHA Durham to come up with kind of a goal and aim for their project, and their hope was to decrease the number of incidents that were resulting in a call to 911, otherwise known as a code white, by 50% by March 31st, 2019. And the way that we did that and worked through the model for them was to, again, kind of determine, okay, we have an idea of what the problem is, but what is actually causing this problem, especially the increase over the past year and a half. So we worked through some tools like process maps, fishbone diagrams to do what's known as like a root cause analysis or diagnostics. From there, we looked at their data to, again, kind of determine the frequency that these incidents were happening and use this information to determine what might be an attainable or realistic goal for them to work towards. And then the really fun part was once they were able to take all of this information back to their team, they came up with some really innovative solutions to try to help decrease that number of incidents from happening. And they were able to do their PDSA cycles to determine what was working well and what probably needed some more tweaking and so on. So this group has really taken to the methods of quality improvement, and I'm happy to say they've got several quality improvement projects underway since then, and they're well on their way to QI capacity in the sector. Which kind of is my segue to saying this could be you folks. So if you are an organization that provides community-based mental health and or addiction services, and you would be interested in project coaching, our application for Excellence Through Quality Improvement, cohort 4, I believe, is going to be open literally any day now. The link will be made available through social media as well as our kind of email distribution list, so keep your eyes peeled for that. And it's really, again, open to any organization that's QI ready to support a project for 6 months. It does take some time and resources, so kind of consider that when you're thinking about applying. And we really ask that these projects align with at least one of our priority areas, those being increased timely access to service, improve client experience and outcomes, or to support the adoption of HQO's quality standards. We are planning on kicking this off in October 2019. So again, keep your eyes peeled for that link once it's available. In the meantime, if you have any questions about E-QIP in general or the coaching, please feel free to reach out to our Director of Quality Improvement, Debbie Bang, or Ashley or Amy, our program managers. They would be more than happy to answer your question or redirect as appropriate. And we love to hear from you folks and your thoughts. Which is actually where I stop talking and I pass it over to Julie to talk about some of the exciting programs and services that are happening in the child and youth mental health sector.
Absolutely. Thank you, Alex. So I will be introducing the center, but first, for some colleagues who may be on the line, not from the child and youth mental health sector, I just want to say a few words about that sector here in Ontario. So across the province, there's approximately 180 community mental health, child and youth mental health service providers that provide direct service to people from birth to 18 years of age. These providers have just recently moved over to the Ministry of Health. Child and youth mental health services are coordinated through 31 lead agencies that have responsibilities in their service areas relating to service coordination, delivery of core services such as brief services, intensive services, etc., establishing pathways and key processes such as youth engagement and family engagement, and around measuring and improving performance. So these lead agencies have been responsible for developing core service delivery plans, where they set up service agreements with other core service providers, as well as developing community mental health plans with sector partners such as school boards and hospitals and public health, etc. So I suspect that many of you have touched on this work in one way or another. So now onto the center. Those of you who know us will know that we've been focused on excellence and high quality mental health services for children and youth here in Ontario throughout our 15-year existence. We have a long history of supporting the sector to improve their services through various programs that do relate to quality, such as on evaluation and performance measurement and implementation of evidence-based practices. So as the sector and the landscape has changed, so have we, and today we mobilize knowledge and improve quality in the sector. We help to ensure continuous improvement across the system by helping agencies deliver efficient and effective services. And I'm especially excited to drop the world premiere on our continuous quality improvement program, Quest, in a few minutes. But first, thank you. We're very good at this, Alex. But first, a little bit about our approach. So while we do our best to adapt to agencies and their preferences, we are trained in Lean Six Sigma as an approach and on its many tools. Lean and Lean Six Sigma, as many of you know, have been really taking off in the healthcare sector. Lean comes from the automotive industry, specifically Toyota Production System and Ford, where they had experienced where there's been a lot of success with that approach. Overall, it aims to reduce waste in processes and maximize flow and minimize any non-value added steps. So things that really don't create value for our customers, or in our case, our clients. Six Sigma, on the other hand, also comes from the manufacturing sector. Its aim of Six Sigma is to reduce variation, to validate hypotheses, and show quantifiable results in a 5-step process, which we call DMAIC. So it's a more statistical approach. And so when you smush them both together, the Lean Six Sigma so combines these two complementary approaches. So viewing Lean and Six Sigma as complementary with the common goal of driving organizational overall excellence. And so it's about combining those tools and those toolboxes together and using what's appropriate at the time. And then next, I want to talk to you about strengths-based Lean Six Sigma. So in our coaching, we are also trying to weave in some aspects of strengths-based Lean Six Sigma, an approach developed by David Chiquette, a Lean Six Sigma expert, that adapted that approach to include more aspects of appreciative inquiry and positive deviance and solution-focused coaching. We've really enjoyed bringing some of that into our coaching, since it's an approach that mirrors how child and youth mental health agencies view their clients. So really focused on strengths rather than focusing on some of the problems that may be there. So focusing on strengths and opportunities can really bring a different kind of energy to quality improvement work, we find. And focusing on things that have gone right, or when they have gone right, on things that you can leverage is a really interesting spin to quality improvement work. So if I'm going to use a second food metaphor in a 1-hour webinar, if we're trying to improve a cake recipe rather than being really focused on reducing unnecessary ingredients and reducing bake time and the number of dishes, we're focusing on adding more of the ingredients that we love into what we're doing. And so now, just as an example of our coaching, I won't spend too long on this, but just want to say that we're, for instance, amongst many others, very proud of the work that has happened at Vanier Children's Services, where the results of the QI project has reduced the time at intake from up to 3 months down to 2 weeks. Process audits are also showing there's consistency in data and documentation relating to intake, and that the success of that project has sparked some other quality improvement projects in adjacent programs. The pictures that you see on the screen illustrate just some of the QI tools and techniques that were used at Vanier. So process mapping, fish bones, monitoring plans, A3s, etc. And I would like to take the credit for that, but it was fabulously coached to by my colleague, Ann Barber. And so now introducing Quest. So this is the moment that I've been waiting for. Unless you, this is your first time hearing about it, unless you follow us on Twitter, which you should. So we've been leaking it there. But this is our new quality improvement cohort program. The center and CNHO are joining forces and our collective expertise to launch Quest, our new program. So let me tell you about it. Quest is a quality improvement program based on Lean Six Sigma methodology, where the selected teams will be coached through an improvement project. It's been designed to support child and youth mental health providers across Ontario in making improvements in two really essential things. So one is around care pathways, the chosen focus for this round at the agency, community, or at the system level, as well as improving on the agency and the sector's quality, culture of quality improvement, because those of you who know QI know that it really is crucial to focus on that philosophy and that culture side of things and really putting the continuous quality improvement. So a few components of the program. The selected projects or sites will receive tailored team-based QI coaching by Lean Six Sigma trained QI specialists, as well as a senior data analyst from here at the center. The program is structured as a cohort model with both virtual and in-person events for up to the 10 sites that will be chosen, because we really do know that the biggest value and the connections that are made through agencies having a chance to learn and share together is really absolutely essential. Relevant members of the core team will receive CHIO's Lean Six Sigma Yellow Belt training. There will be a small grant to help with improvement efforts. For instance, it could be used to enable participants, youth and family participants in participating in the quality improvement effort. And the selected sites will be using an Ontario modified QI maturity tool to gain insights and to track progress relating to continuous quality improvement culture in their agencies. So we're really excited about that aspect. So why bring a cohort together around care pathways? Well, as you know better than I do, care pathways are essential. So they guide children, youth, and families to, through, and out of care, and they ensure that families get the right service at the right time and with the right modality to best meet their children or youth's mental health needs. So I've listed a few examples here that things that we think would relate to care pathways. So for instance, an agency wants to reduce the time at their intake process. An agency wants to improve access to a particular service where there are redundancies or inconsistencies, or an agency wants to improve the process of transferring coordination with school mental health supports or another body. So the cohort program will run for 12 months, beginning in early 2020, followed by 4 months of support focused on sustainability, scalability, spread, and knowledge mobilization. So during that 2020, there will be 2 in-person events as well as other virtual events for the cohort members. So now that I've piqued your interest, so the application launches September 17th and will be open for about a month, with the program starting in January 2020. Eligibility criteria is to be an Ontario Ministry of Health funded child and youth mental health provider, not currently receiving other external funds for that same proposed quality improvement project, including effect funding from us here at the center. So in the meantime, start thinking about what improvement opportunities exist within your care pathways and what kind of impact it could have on the lives of children, youth, and their families. So lastly on this, just wanted to flash up my wonderful colleagues, as well as most importantly, the Quest email address. So any questions or anything, please do write to that email address, and keep an eye on cymh.ca, so our website, which already has a little bit of information, and we'll continue to add that. So with that, Alex, I think that we've talked quite a bit, and it's time for folks to pick up their phones and let us know if you could improve one thing in the mental health and addiction sector today, what that thing would be.
Bet they thought we forgot about the polls.
I was itching for the poll. I was excited to get back to it.
Ooh, wait time.
Reducing wait times, access, absolutely. Transitions, huge, yeah. Improving client experience, more transparency in the community.
Ooh, evidence-based practices, that's a big one.
You have the availability of services.
Funding for QI. Who is this? I want to give this person a hug or a high five. The funding for QI.
Better care coordination. Yeah, absolutely. Communication between service providers. The value of QI. Dropout rates for groups. Lots of potential QI projects here, right?
It sounds like people are on the right track and they've got some ideas. All right. It looks like the poll is closed, so we've got our max number of responses. Thanks, folks.
I'm glad culturally appropriate services got in there. I like that one.
Inclusion of the family.
Oh, great.
Perfect.
Absolutely.
And this one's more of a plug for ourselves. Which is your preferred method for receiving updates about QI in the mental health and addiction sectors? Email? Oh, well, there's like a resounding consensus around email.
Are we going 25 for 25 on email?
Ooh, newsletter, thank you. This is great because, you know, you never want to assume about how people want to be contacted, and this is very helpful.
We will shortly be reminding people of our fabulous listservs and Twitter handles for both of our organizations. So that's great.
Excellent. I am seeing a bit of a theme here, so we'll progress to the next one.
We'll move along.
Oh, email webinars. Thank you for the webinar shout out, which is an amazing segue to webinar series part 2. So we are hoping that you folks got to learn a few things today and are interested in the offerings that both the Center of Excellence for Child and Youth Mental Health and the Excellence Through Quality Improvement Project are offering. And we're hoping that you may consider joining us next time, where we're hoping to highlight some of the projects that we've supported in the past, emphasizing how the organization used data and quality improvement tools to improve either access, timeliness, or quality of their services. So Julie and I both gave you guys kind of quick snippets today, and we're hoping to kind of dive into those a little bit deeper, because I find, and Julie, you can say what you hear most often, but I typically hear that organizations are just wondering where to start when it comes to quality improvement.
Mm-hmm. Yeah, absolutely. And really, you have to start somewhere, right? That's the continuous part of it.
It's true. So hopefully we'll inspire some folks with that. It will be on November 14th at the same lunch hour, and there's a registration link there below. And so while Alex clicks through these resources, this is a good time if folks do have questions. I think we'll have time for a few questions. So if there are some, you can start populating the question box. Great. Thank you for the reminder, Julie. So please, if you've liked what you've heard today and want to learn more about what's going on in quality improvement in the mental health and addiction sectors, adults and Child and Youth. Please follow us on Twitter. So we've got our handles there. Please don't feel like you need to pick one over the other. Follow us both. Like we want to hear what you folks have to say. And we both have newsletters, so links here. I do always really appreciate the news that I get from the Center of Excellence. You folks always have a lot of really cool stuff going on. And some other webinars and resources that have been put together. So we at E-QIP are huge lovers of webinars. I've kind of linked some of my favorite ones here today. The one that's missing that should be there is we also had a joint presentation between Canadian Mental Health Association and the Addictions and Mental Health Ontario. They did a joint webinar talking about Ontario health teams and what that means for mental health and addiction sector. So if you navigate your way to our YouTube page, you can check that out as well if you had any kind of outstanding questions from that piece this morning. Center of Excellence has a really great resource hub. I don't know, Julie, if you want to say a couple of quick words about that.
Yeah, so it's a great resource for folks across the province and beyond that. Lots of great ways to filter and sort through the loads and loads of information and great evidence-based products that we have on there.
And what I find, although with Excellence Through Quality Improvement Project, we're very quality improvement oriented. At the center, you folks have kind of everything from political hot topics to performance measurement and so on. Another thing that we kind of want to flag people for is the Ideas Foundations of Quality Improvement training. So if you do find yourself registering for the E-QIP newsletter or following us on Twitter, we'll let folks know when we are having the one-day Foundations of Quality QI training. So it is a full one-day workshop. We offer it free. We try to travel across Ontario and offer it where we can. And really the hope is to have everyone from frontline, admin, support, management, you name it, attend these sessions to help really, again, build that capacity around QI and have people start speaking the same language around quality improvement tools and methods. And if you've taken other trainings previously, like this is a good kind of refresher for folks. And I think we've got a couple of questions coming in.
Yeah, so I see one here, Alex. So there's a question about whether or not there will be a place to access the reports from the completed Quest projects. So my answer to that is yes, absolutely. Surely on the center's website, we would host kind of a summary of how those projects went. Or those projects go. That is quite a ways down the line, though, as we're just launching now and projects would be taking place during 2020 and beyond. So in the meantime, I think following us through field notes and following us through Twitter is the best way to access information on what's happening. But in the meantime, folks should look out for the application and participate in the program.
Great. And we do have some time for a couple other questions if people want to roll those in. But if you're in a hurry to move on to your next meeting, now that the lunch hour is coming to a close, if you take the opportunity to do one last poll and let us know what you thought of today's webinar. Very quick and easy little smiley face summary here. Let us know what you thought. And keep those questions coming in. We'll be here for the next minute or two. And if you have to leave, thank you for joining us and have a great afternoon. Seem to have closed my question field. We did receive another question about opportunities to bring the two sectors and quality coaching programs together to improve pathways from CYMH to adult services. That is a great question. I do not know if there's any sort of formal plans, but I believe like Julie, if an organization wanted to focus on moving transition-aged youth from child and youth mental health to adult services, would that be a project that you would likely support?
I mean, absolutely, right? So there's still the criteria of being if it's someone from the adult side asking that, then they would need to kind of really be connected to that child and youth mental health serving organizations. But absolutely, we know that transitions is a major issue. And so that would absolutely be something that would be appropriate and would touch on care pathways.
Yeah, for sure. And I know with the projects that we've supported looking at transitions, it really comes down to sort of the project team composition. So if we have an organization that's looking at transitioning to and from hospital, for example, they would make sure that their hospital counterparts are part of the project and that everybody's bought in and on the same page. So nothing formal, but it sounds like we can probably address that need as needed.
Absolutely. Okay, well, Alex, shall we give people 3 minutes of the gift of time? I'm not seeing any more questions rolling in, or are we seeing?
Yeah, hearing no further questions, and folks have contact information available in the slides if they need to reach out to either of our teams. One squeaked in at the very last second, and it is, does anyone use the Inter-I as part of their quality improvement? So I guess you're probably referring to the Inter-I suite of tools. I know there's a couple different varieties, for instance, the CHIME in the child and youth mental health sector. There we go. Yes, definitely the CHIME. So Julie, do you want to take a stab at that one?
I mean, so I think there's probably a long, great answer to that. I think the short answer is yes. I mean, any kind of data that you can access can be folded into a quality improvement project, right? So, whether or not there's some troubleshooting to do around that implementation of it and kind of how it's working and whether or not it's doing what you thought it was supposed to do. So the short answer is yes, there would be ways for that to be folded in, whether it's looking at the data and what the data of CHIME, for instance, or the Screener Plus are giving you, and how to incorporate that into the work moving forward. So in a quality improvement project, you would certainly be looking at all sorts of sources of data and looking at what that data is telling you.
Yeah, for sure. And I think anytime we can use standardized assessments to measure outcomes, we can establish a baseline and how we work towards improvement and kind of monitoring how those things change as we do a quality improvement project and look at testing out change ideas. So yes, data, especially standardized assessment data, is great because it keeps things consistent across the board. Cool, thank you for the question. Great, and at 12:59, I think it's safe to say that our hour is up, and it has been a pleasure. So thank you, Julie, and thank you folks for joining us. Have a great afternoon.
All right, bye everyone.